showing you that sometimes we show our position instead of 12, sometimes do 9, 10, 11, sometimes do 1 o'clock. Your assistant should be in a higher level than you, and you need to make sure that the bracket table is accessible. Also, in case if you're working 400 and testing not 600, because with 600, you have another assistant on that side. This is the way. If you look from the back, you need to have a good shoulder rest. So, with a rest, you can control the level. This is too deep, it's not okay. It's also too high, it's not okay. You need to adjust it to have a good shoulder rest. So, give you the advantage of ergonomics with a microscope. And when it comes to the patient, most of the patient will enter the clinic sitting in the chair situation, which is one of the microscopic position. You need to ask the patient to get back to the maximum of the chair and resting his head on the headrest. Yes, this is right. And don't start or jump directly to the microscope when you talk to the patient or the hospital or you examination, and also laparoscopic examination without any kind of any sort of magnification or alignment. You have a wide view, wide general image of the patient health. And then when it comes to examination with microscope, I would love to sit in a position from 9 to 11, not 12 position, whereas 10 can evaluate each aspect of the patient health. Here I'm in 10 position. This position is only for the use as a time for clinical inspection and identification. Again, for the left side, will be very more still weak. And this is for the lower. Again, from the same side, you can examine the lingual plastic or lingual sample. The liver incisor, again for the nasal incisors. Same position for examining the background plastic of upper and lower incisor. Once examining or going to land and lower position, patient almost 180 degrees, miniature 180 degrees. And don't move the microscope. And control patient position, consistent. Microscope in right position or right relation movement. You can move the patient or move it to the left. And here, you will show that you can access any patient mouse from the position. Here's the exciting one. For sure, rubber dam is very important to avoid getting this fault. And if some situation you work without rubber dam, you need to ask your assistant to blow air in that manner to make it always visible.
So the most important question, does the microscope help to improve the skills of the operator? Actually, this is the evidence-based because in an article published in the Journal of Endodontics about how the microscope can improve some of the skills of the clinician, we can see that the microscope improves the motor fine skills of the clinician, irrespective of the use of experience, as well as irrespective of the age of the clinician. So when you use the microscope, you will be able to perform very fine jobs inside the tooth on the microscope. So going back to the workflow, we start using the microscope not only for difficult cases, not only for separated instruments, perforations, but starting from the diagnostic workflow. We need to look, as Dr. Muhammad showed us, about examining the patient. So we need a microscope sometimes for examining and diagnosing the case. And in these cases, I will show you here that we can check the integrity of the coronal restoration by the microscope, because sometimes we need to decide whether we need to remove the crown and do our root canal treatment, or we have a good crown, good margin, so that we can go directly for micro-apical surgery, for example. So it's important to examine the periodontal as well as the marginal allocation of the restoration. Another part of the diagnosis, which is a really difficult part, is sometimes patients are coming complaining of symptoms of pulpal inflammation in sound teeth or restored teeth without knowing the actual reason for the pain. We have a filling, good filling, and we have sometimes sound tooth, but the patient is complaining of severe pain like pulpitis. So